What questions should I ask my lung cancer team? Getting a lung cancer diagnosis can feel overwhelming, but asking the right questions helps you understand your situation and treatment options. It's important to communicate clearly with your multidisciplinary cancer team to make informed decisions. Start by asking about your specific diagnosis. Find out what type of lung cancer you have, whether it's non-small cell or small cell lung cancer, as this influences treatment choices. Ask your team to explain your cancer's stage and what that means for your outlook. Knowing if the cancer is localized or has spread helps determine the best approach. Request details about your biomarker testing, including molecular and PD-L1 testing. These results can guide targeted therapies or immunotherapy options that might be suitable for you. Make sure to understand your pathology report and lab results so you know exactly what your doctors are seeing. Clarify who is leading your care and what each team member's role is. Your team might include a surgeon, medical oncologist, radiation oncologist, pulmonologist, and other specialists. Ask each person to explain how they will work together to support your treatment. If surgery is involved, ask how many lung cancer surgeries your surgeon has performed. High-volume surgical teams tend to have better outcomes. When discussing treatment options, ask your team to explain all available choices tailored to your situation. Find out if they recommend a specific plan and why. Clarify whether the goal is to cure the cancer, slow its growth, shrink tumors, or manage symptoms like pain. If your biomarker results suggest you might be eligible for targeted therapies or immunotherapy, ask about those options and whether combining treatments is possible. Also, inquire about clinical trials you might qualify for and how to access them. Timing is crucial, so ask how quickly you need to make decisions and what steps you should take to prepare. Knowing the timeline helps you plan and reduces stress. If chemotherapy is part of your plan, ask about the names of the drugs, how they will be given, and what side effects to expect. Find out what can be done to manage these side effects and how often treatments will be scheduled. For radiation therapy, ask how your treatment will be planned, what scans will be used, and how many sessions you will need. Understand how long each session takes and whether healthy lung tissue will be affected. If chemotherapy and radiation are combined, ask about additional side effects and how they might impact you. If surgery is involved, ask whether you will have chemotherapy or radiation before or after the operation and why. This helps you understand the reasoning behind the treatment sequence. Practical questions are also important. Ask about the costs of your treatment and whether your insurance covers it. If not, inquire about financial counseling or assistance programs. Find out where your treatments will be performed, how long each session lasts, and if you need help with transportation. Clarify if someone should be with you during treatments and if you can take your other medications on treatment days. Monitoring your progress is key. Ask how your team will assess if the treatment is working and what signs or symptoms should prompt you to contact them immediately. Find out how to reach your team during nights, weekends, or holidays. Ask if you need to make any dietary changes or activity restrictions during treatment. Also, request tips on managing side effects and whether mental health support is available if you feel overwhelmed or distressed. Looking ahead, ask about your prognosis and what your life might look like over the next year or more. Get a realistic picture of best and worst case scenarios. Find out what options are available if the treatment does not work or if the cancer comes back after treatment. Ask about lifestyle changes that could support your health during and after treatment, like quitting smoking or improving nutrition. It's also helpful to ask your team what advice they would give to a friend or family member in your situation, as this can reveal their honest perspective. Finally, consider asking whether you should seek a second opinion and, if so, which other specialists you might consult. Request educational resources like websites or brochures to learn more about your condition and treatment options. Asking these questions empowers you to take an active role in your care and ensures your treatment plan aligns with your goals and values. Remember, your healthcare team is there to support you, and open, honest communication is the best way to navigate this journey. Always consult your doctors for personalized advice tailored to your unique situation.